New regulations and research have arisen this year surrounding lead exposure prevention. Milea Burgstahler with the Barry-Eaton District Health Department sits down with us today for further insight. Milea, is there a reason for these increased preventions or bringing awareness to lead exposures?
Sure. So we know that no level of lead is safe in the body, and it can cause harmful effects for anyone. Lead is a toxic chemical that causes a lot of problems for little ones, especially children under the age of 6, and for pregnant women. So lead exposure could cause things like slowed growth and development, learning and behavioral problems, and damage to the brain and nervous system.
So just a few of the many things that lead exposure can do and the harms of it as well. You mentioned the dangers to moms, to babies. We've talked for years and years about lead exposure with pipes, lead in paint, and there's so many things in our environment that you could be possibly exposed to lead. When it comes to this new research, what is it saying about the dangers? Is there anything new with lead exposures or something that people might not really be aware on?
Sure. So lead exposure can come from a lot of different places, but the most common is from lead paint from homes built before 1978. And we know this. We've known this for a long time. But we also know that it can come from some other sources that you might not think about as often. So imported goods like spices and cosmetics and some household items. If you think about it, when you import goods, sometimes other countries don't have the same standards that we do, and so they might not catch that there's lead in the product. So it's really important to know where your lead exposure is coming from, and the only way to do that is to perform a simple blood test to know if your child has elevated blood levels.
So for clarification, what you're saying is there might not be certain symptoms to look out for, but it really is crucial to get that blood test.
Yeah, most children don't have symptoms and they don't look sick.
So what would you recommend then if there were concerns if a child or an adult were exposed to lead, but they weren't sure if they should get a blood test?
Yeah, so Michigan actually implemented a new law back in, I think, May of this year. And so now it's required that providers test children at the ages of 12 and 24 months for elevated blood levels. Previously, we were only testing children on Medicaid. And so we're seeing more children test with a higher blood level because we're simply testing more children.
Okay, so there's maybe more of it's because you're doing more of this testing that you're seeing more of these results when it comes to the lead exposures.
Yes, exactly. We're not necessarily seeing more lead exposure in the community. It's really due to testing more because of this change in requirements. And then also, if you think about it, in 2020, the COVID pandemic really delayed routine care for families. And part of routine care can be blood level testing.
So this is almost like a little game of catch up right now and being able to look at the data and see what's going on.
Yes, exactly.
Recently, the Barry-Eaton District Health Department had a training where they were able to educate people on lead symptoms or exposures and what to do with that. If people do have those concerns, are there upcoming events with the department, or what's that first step they want to take?
Yeah, there are really great resources out there on the internet. So michigan.gov/myleadsafe, and that's MI-leadsafe, is a really great resource for parents and providers to learn more about it. But also, if you have your child and they test positive for lead exposure or have an elevated blood lead level, don't freak out. There are things that we can do to help prevent damage for the future. One of the things that the health department does is nurse case management. So a nurse would come out to the family's home, investigate the source of the exposure, and help to get rid of that. Sometimes it's really easy, and it might be a spice that you bought or a good from Amazon that came from another country. Sometimes it's a little more difficult, and it might be the paint in your home, and that's a bigger project. But there are resources out there that our nurses are really familiar with that they can recommend to help get rid of that exposure. And then the other really great thing is that a healthy diet can help so that your child doesn't absorb lead into their blood system. So things that are high in calcium and vitamin C and iron will help to prevent absorbing lead into the body.
That's incredible to know. I'm almost jaw-dropped over here that even your diet and lifestyle can help to reduce absorbing that lead into your system. Yeah. And like you said, it's all about having the awareness and detecting it. There are concerns, but you don't need to freak out yet because there are those resources available. Well, Miley, we appreciate you for joining us and sharing more on what we need to know about lead exposure and prevention.
Yeah, thank you.